All right, so this is part 2 for chapter 8 in your pharmacy practice for technicians book. We're covering prescription health insurance or prescription drug insurance, health insurance in general. So we finished on slide 15. We're going to pick up on slide 16. So this is going to cover commercial health insurance. So commercial health insurance is either paid for by the individual or through their employer. It's also known as third-party insurance, private health insurance, or employer health insurance. Typically, the employer will pay a percentage of the monthly premium. And the rest then will be deducted from the employee or patient's paycheck pre-tax. So the Affordable Care Act in 2010 sought to increase the number of insured Americans and mandated that businesses with more than 50 employees offer health insurance. That still stands. The only thing that has been removed from the Affordable Care Act is the penalty at the end of the year if you do not have health insurance. So there's 3 main types of commercial insurance. You have health maintenance organizations known as HMOs, and these plans basically are staffed with their own doctors. The patients or individuals who have HMO insurance must use the HMO doctors or other doctors that they have the contracts with the HMOs. If they go outside of that network, they're going to pay more money because it's considered out of network, and they don't cover that through the insurance. Preferred provider organizations, known as PPOs, these plans just encourage the employee or the patient to financially use doctors that they have contracts with, because they get a lower cost if they see the in-network provider. So if your provider is considered an in-network, you're going to pay a cheaper amount than if you see an out-of-network doctor. But let's say you switch jobs, you change insurance, and your physician you've been seeing for 20 years is not preferred, you can still see them. You're just going to pay a little bit more out of pocket. Traditional insurance plan is that the patient can choose any plan, choose any doctor and pay a set percentage on that. So HMOs and other commercial insurance plans, they try to contain cost in a few different ways. So they encourage plan members to use preventative care. So immunizations, annual exams, doing those particular health screenings at certain ages. When we turn 50, we do the colonoscopies for colon cancer screening. 40 women do mammograms for breast cancer. Men do PSA checks for prostate cancer, those type of things. Use restricted drug formulary. So again, your drug formulary is a list of covered drugs. These lists are used to emphasize the use of lower cost generic drugs, which not only benefits the insurance company but also benefits you. They will require referrals by a primary care doctor before a higher cost specialist. So they want to make sure that you being sent to a specialist is actually warranted. So they require that referral before they allow you to go see that specialist. They will assign a case manager to a patient with very high medical costs. So let's say a patient has many different medical conditions or diseases and they see a multitude of specialists every month or every couple of months. They're going to assign a caseworker to help try to keep those costs down. Other types of health insurance, so supplemental health insurance, secondary insurance is additional insurance plans that pays for services that aren't covered by the primary plan. Workers' compensation is an insurance paid for by the employer to cover the cost of injuries or illnesses related to a worker's job. So workman's comp coverage is specific for a specific injury. Generally has an expiration date determined by the type and extent of the injury. So if you break a leg or sprain an ankle at work, they know typically how long that takes to heal and what the process is, so they put a time limit on that. Government insurance plans, so Medicare, this covers people 65 and older. It also covers disabled individuals. It is administered by the federal government, and there's different parts. So you have Medicare A, B, Comprehensive C, Medicare Part D, and each of them pay different types of claims. Medicaid, or as we call Access in Arizona, covers low-income individuals and their dependents, and it is administered at the state level. So the state is the one that decides what the qualifications are, who covers it, and they cover the insurance. TRICARE covers active military members, veterans, and their dependents. It is administered by the federal government. CHIPS is a program specifically to cover children aged 0 to 19. This is administered as the states, as would Access would be. Health insurance exchanges, commercial insurance plans with premiums that are subsidized by the government based on a patient's income, and again, those are administered by the states. The idea with the health insurance exchange is that it was providing subsidies for individuals and families to be able to offset some of the costs of the insurance and help individuals and families get insured. Medicare covers elderly patients and disabled, so there's 4 different types of Medicare insurance coverage, and they cover different products and services. So Medicare Part A covers the hospital stays. They cover the skilled nursing care, home health care. The retail pharmacy, we do not deal with Part A at all. We don't bill it, we don't deal with it, but we need to know what A covers. All patients 65 and over receive Part A coverage. Monthly premiums for all patients or all individuals on Medicare for Part A are the same. Part B covers doctor visits, flu vaccines, any durable medical equipment that's necessary, so wheelchairs, shower stools, any type of things like that. Diabetic testing supplies are also available to be covered through Medicare Part D. However, most of the time it will require a physician's prescription to be able to get those type of things covered through the insurance. All patients or individuals 65 and over receive Part B, and again, their monthly premiums are the same. So it doesn't matter if you live in Alaska or you live in Arizona. If you're 65 and older, the amount that you're paying as a premium for A and B is completely the same as every other patient on or individual on Medicare. As you get into the other options, that's what's different. So Medicare A and B only cover some medical services. So it's important for some patients to purchase additional or supplemental private insurance. This is known as Medigap, and that's used to supplement what A and B does not cover. Medicare Part D was actually put in effect to cover the high cost or cover cost of prescription drugs. Part D is not just automatically given to patients when they enroll into Medicare. This is a supplemental coverage, but they have to pay for it, so it's an additional premium. So it's an optional coverage with an additional monthly premium dependent upon the plan that the patient chooses. That's how much their plan is going to be. Many plans are offered through private insurance companies. Many plans have a deductible. Informs patients once they turn 65 that they are eligible for Part D insurance coverage. So once an individual is turning 65, they're going to get notified that they're qualified and able to receive Medicare. Part D, typically the patient will pay only about 25% of the drug costs until the annual limit is hit, which is approximately $3,000. So between $3,000 and $7,000 and $7,062, that is what is known as the donut hole. In between that amount, so the patient will pay 25% of drug costs up to $3,000. From $3,000 to $7,062, they pay everything. That's the donut hole. Okay, they will pay the majority of the cost. It says in 2019 that the donut hole will be eliminated, but we still do see some of the donut hole left. After the $7,062, the insurance will then cover all of the cost. So it's that window that they call the donut hole. They pay 25% up to $3,000. In between $3,000 and $7,000, they pay everything. After the $7,062, the insurance covers it all. It does provide catastrophic coverage for patients with very high costs. You can have a diabetic patient that is going to run through that $3,000 monthly just on their insulin, an HIV patient monthly just on their HIV medication. So it was very important that they start to shrink that donut hole and figure out ways to help our elderly population be able to afford their medications. So if you look at the picture or the chart on slide 25, it actually shows you that difference. So the enrollee will pay, the patient will pay 25%, Medicare will pay 75% up to that $3,000. It shows you where the donut hole is, and then after that it'll show you what the catastrophic coverage is. So Medicare Part C is the comprehensive. So it's a comprehensive plan that covers everything that is covered by A, B, and D. So it's an all-inclusive, okay? It's a comprehensive. So it kind of wraps them all three into one. It does have an additional premium. Commercial insurance companies will administer these plans. It's also known as Medicare Advantage plans. And they do have higher monthly premiums than the other Medicare plans because it's wrapping all three of them into one. But there's many choices and there's many plans to choose from. So a lot of patients will go that route. Medicaid, as we in Arizona call it access, covers healthcare and prescriptions for low-income people. It covers some benefits for disabled. So it's run jointly between the federal and the state programs. But typically, like here in Arizona, the state of Arizona determines what are the income guidelines, what are the requirements for someone to be able to qualify for access. And then it's ran and paid out in conjunction with the federal government. So again, eligibility requirements. So what is required of individuals to qualify for access in Arizona may be different for them to qualify for Medicaid in New Mexico. So the states determine that specifically, and it's going to vary from state to state. There's no monthly premium, but sometimes there will be a copay, at least at the pharmacy. And again, that's a sliding scale type thing. Children's Health Insurance Program, or CHIP, is a low cost or free state health insurance plan that covers children whose parents have income above the poverty line, so they don't qualify for Medicaid, but it's insufficient to cover the healthcare costs. So let's say that they make too much money to qualify for access, but they don't make enough money to pay the monthly premium to have a family health insurance. So that's where CHIPs come in, and they will insure children from 0 to 19 to make sure that they have health insurance. The Affordable Care Insurance Exchange programs were designed to expand the number of insured people in the United States with subsidized commercial insurance. So again, most of the exchanges are state-run. Some are federally run, but ideally what they're doing is they're providing a subsidy to individuals and families, and they pay a premium based on the sliding scale of their income. So for those who qualify, 85% will pay less than $100 a month. Many plans to choose from all have a cap on out-of-pocket costs. So the thing is, the idea behind the exchange, again, was to provide health insurance coverage for all the citizens of America and be able to afford it by offering the subsidies based on income. So we're going to end on slide 28. We will pick up on slide 29 for part 3.